My name's Dr. James Hodgkinson. I'm a doctor here at the State Major Trauma Unit at Royal Perth Hospital, and we work on basically saving people's lives when they come in from major accidents, say for example being hit by a train. An average body's 72 kilos and it has no chance against the momentum of a train. The other thing you've got to consider is not just being hit by it, which is a blunt trauma, but then there's also the slicing effect that goes on with the undercarriage. It's like a pincing kind of grip, or even knife-like in relation to the train wheels going across the train tracks, and any soft tissue of a body that gets caught in that is almost immediately amputated. If your head is hit at great speed, look, at best you might end up with bad concussion, but really at worst it's death, and halfway in between could be anything from a head injury that doesn't allow you to be able to use your arms and legs for the rest of your life. Rehabilitation from someone who's been hit by a train or even just glanced by a train can vary. Like we said, if worst case scenario someone passes away, but if they're just shy of that, they could be in the intensive care unit for weeks, if not months. They could then come down to a step-down clinic or a ward like this, like a critical care ward, and be seen here. That's still when they're in acute phase, when we're still worried about them passing away, for things we need to watch out for. Then they might be transferred to Shenton Park campus for rehabilitation for many, many more months. And they go to outpatient treatment there, so maybe once, twice, maybe even daily, be driven to and from the hospital to get physiotherapy, to be getting occupational therapy, to be seen by a speech pathologist because they're unable to swallow. And some people never come back from it. They can get constant rehabilitation just to maintain them at a very low level of functional ability and never improve from there. So it's something that can go on for years and years. I was called to a country rail crossing where a young group of boys had tried to get across a train line. It was a large train, a long train, and they were trying to outrun it because they didn't have to wait for 2 to 3 minutes for the train to go by. And in this situation, it was a young bloke who was well liked, big family, lots of friends. And unfortunately, in this situation, he wasn't able to outrun the train. In that situation, when it did hit him, he was unfortunately lost 2 of his limbs, lost his right leg and his left upper limb. And I know now that he suffers from significant depression. He at one stage when he was in hospital had said to us that he wished that we hadn't saved his life because he didn't want to be able to go around with only one arm and one leg. And that's difficult for us, knowing that we did everything possibly could to save his life. And in the end, he didn't want to be around even though we'd saved him. Some of these patients are actually quite selfish. They think about the impact to themselves, but they don't think about the impact to anyone else. They don't think about the impact to their family. If I touch on that, you try and be a doctor who then walks out of a theatre or walks out of the emergency department to tell a mother that their only child has just passed away, or that their child will never recognise who they are again because of the brain injury they've got. It seems like a useless waste of life at times because of decisions that people haven't thought about consequences. I can understand maybe some young people haven't seen some of the dramas that go on. They haven't seen some of the outcomes or some of the things that we do. Some of the medical staff and some of the nurses really struggle, and it takes a large toll on the people in the hospital end that goes on, and some people can't work in this area because of that.